Good evening to everyone and welcome to today's session. So morning we had a great revision of anatomy. 200 hours. How is it possible to do the revision as a crash course? It is possible if you have the end in mind, what is asked by examiners, what you need to master. If you know that there are 20,000 questions, any student has to practice to become a topper. So let's make the great beginning. Good to see 8 online students. Can the online students punch whether the voice is loud and clear for everybody? Yes. So continuing our journey in anatomy, we finished the first 8 high-yield topics in my past 2 episodes. Thanks for joining this today's evening. We'll continue our journey today with another 10 topics. We get a hold on the subject of anatomy. Good to see Sayeda and many more. Rectum is a very high-yield topic. Fascia of Vardhathey, where do you see? Between the rectum and the sacrum bone is there, and the rectum is going to become anus. So between the two, you have the fascia of Vardhathey is what you need to remember. So you should be very sure that there is a bladder, there is a rectum. Between the two, you have the denonvillus fascia. Rectum के पीछे क्या है? Rectum के पीछे है sacrum. So between the two, you are having the Vardhathey's fascia is what you need to remember. So if you look anteriorly, you have the bladder, posteriorly, you have the sacrum. So here you are having the presacral fascia. And there is a mesorectum. This is the rectum. Here you have the superior rectal artery. Then these are the lateral ligaments. This is the middle rectal artery. And here you have the bladder, which is anterior. Separating the bladder anteriorly and the rectum posteriorly, you have the fascia of denonvillus is what you need to remember. Good to see Dr. Vikas and many more who are all online. Please drop a line to all your friends that the live every day daily session, a free daily session with Dr. Murali Bharadwaz, 200 hours live, is going to happen every day, Monday, Tuesday, Saturday, Sunday, any day until you are NEET PG. So what are the supports of rectum? There is a rectovesical fascia of denonvillia, which typically extends from the rectum behind to the seminal vesicles and prostrate in the front. So this is the sacrum, this is the bladder, this is the rectum, and here you have this Vardhathey's fascia is what you need to basically remember. The Vardhathey's fascia. This is the levator ani, the anacoccygeal ligament. So you need to have a 3-dimensional perspective and a view of the rectum and surrounding areas. So what is this fascia of Vardhathey? From where it starts, where it attaches, what is its surgical significance, Everything you should be sure. It attaches to the lower part of the ampulla of rectum. From there to sacrum, between the two, it is a connecting string, is what you need to remember. Valday's fascia is the condensation of the pelvic fascia. It contains superior rectal vessels. Lymphatics, the pelvic floor, levatrinae, lateral ligament of rectum, pelvic peritoneum, they're all the surrounding structures. So every time examiner front and back will keep asking you the same thing. So what is Denon-Villar's fascia? Keep punching the answers, doctor. It is there between the prostrate and the rectum. You have the Denon-Villar's fascia. Good to see Manali Gaur. Keep punching the answers. So Denon-Villar fascia is anterior to the rectum. So that is the reason it is typically there. What is anterior to the rectum? Bladder, seminal vesicles, prostrate, everything. Now, what are the derivatives of the midgut? कहाँ तक midgut बोलते हैं, कहाँ तक hindgut बोलते हैं? What is the blood supply of this? Is a favorite question. Ascending colon, appendix, jejunum, everything comes under midgut. So the lower duodenum to the first 2/3 of the transverse colon, you like to call it as the midgut. So lower duodenum, jejunum, ileum, cecum, appendix, ascending colon, first 2/3 of transverse colon, that all comes under midgut. Midgut is supplied by superior mesenteric artery. Foregut is supplied by celiac trunk. Hindgut is supplied by inferior mesenteric artery. बराबर याद रखना. Hostrations, radiologically also, hostrations are most prominently seen. Where do you see them? Keep punching the answers. Sigmoid colon. So if you look at the anatomy of the large intestine, you have the cecum, colon. So if you look at the colon, the circular muscle layer is complete, the longitudinal is incomplete, leaving bands called tinea coli. And whenever there is contraction of this tinea, they form the pouches which are called hostri. Similarly, colon is recognized by small fat-filled pouches which are called epiploic appendages. And the mucosa of the colon has tubular glands which are called crypts, is what you need to remember. And there are a lot of goblet cells in colon, because they're very important to increase the absorptive surface of the colon. Rectal continence is because of which muscle, doctor? You need to know that it is the puborectalis. You can see the rectum blending into anal canal. It is the puborectalis muscle which acts like a sling and maintains the anorectal angle and prevent the stools from drooping down, from falling down. It is the puborectalis. Lymphatic drainage of the anal canal, one of the favorite questions in entrance. Above the dentate line, below the dentate line, you have to be 100% sure, doctor. So you should know, above the dentate line, There are a lot of anal valves. The entire mucosa is folded, pleated, 12 to 14 columns of Morgagni. Between the columns, you have the anal crypts, cuboidal epithelium, ice cubes, hai na? Cuboidal epithelium that is above the dentate line. Below the dentate line, there are no crypts, there are no columns of Morgagni. It is a smooth mucosa and it is a squamous epithelium, is what you have to remember. So if you look at the pectinate line, above the pectinate line, it is all sympathetic, parasympathetic, and sensory innervation. Below pectinate line, you have somatic, motor, and sensory innervation. Above the pectinate, it is the inferior mesenteric artery which supplies, because it's a part of the hindgut. Below that pectinate line, the branches from internal iliac artery supply. Below the pectinate line, all the blood will go into inferior vena cava, caval venous system. Whereas above the pectinate line, it goes into the mesenteric vein, which merges with splenic vein to form the portal vein. So it goes into portal venous system. Above the pectinate line, lymphatics will go to internal iliac group of lymph nodes. Below the pectinate line, it goes into the superficial inguinal lymph nodes. That is what you have to emphatically remember. So the anal canal above the dentate line is supplied by the terminal branch of superior rectal artery. So what is superior rectal artery? Superior rectal artery is also called hemorrhoidal artery, which is the terminal branch of the inferior mesenteric artery. Whereas the middle rectal artery, which is the branch of the internal iliac artery, and the inferior rectal artery is the branch of the internal pudendal artery, they supply the lower anal canal, is what you have to emphatically remember. So, doctor, you have to be very sure. What is middle rectal artery? Is a branch. It is a branch of internal iliac artery. Inferior rectal artery is a branch of internal pudendal artery. And superior rectal artery को दूसरा नाम क्या है? Hemorrhoidal artery. And what is superior rectal artery? Superior rectal artery is the terminal branch of the inferior mesenteric artery. This is the favorite MCQ of the examiner. Pectinate is an important landmark because it is a line of division of nerve supply, epithelium changes. It represents lymphatic and venous divide, everything. That's the reason you need to remember. So that is all the story of rectum that you need to remember. Now, the next topic is axilla. So once more, doctor, I want to tell all of you to download Incus quiz app. So Incus quiz app. 20,000 MCQs with explanations, topic-wise, subject-wise, classified, created as 1,000 quiz tournaments, each containing 20 MCQs. Every time you are playing the quiz, you are getting a competitive analysis in comparison to others. It will hardly take 10 minutes to do a 20-minute quiz, but that will be very refreshing. And after you answer the quiz, it will go into history. And in the history, every quiz, you can review all the questions asked in the quiz. And you can add audio comments, video comments, like TikTok video, you can add to that. So please inform your friends also to download and enjoy playing on Incus quiz app. All these questions, we created each topic-wise quiz tournaments and made it available for you to play and enjoy learning. Anterior wall of the axilla, how is it formed? It is formed by the pectoralis major, pectoralis minor, clavipectoral fascia, वो सब anterior wall होता है axilla का. Subscapularis teres major, latissimus dorsi. Good to see Kashyap, Spandana, Rajesh Babu, everybody. Very good, very good. Please invite all our other buddies who are all preparing. I know IPL match is very interesting today. हमारा Hyderabad का SRH और Mumbai Indians are fighting, right? So I'm also tempted to skip the class and attend the IPL match, but you guys are also like some of the top champions of the tomorrow's exam. So always it is enjoyable to spend time with you guys. Medial wall is formed by the first four ribs and the intercostal muscles, serratus anterior. Lateral wall of the axilla is by the intertubercular groove and biceps tendon. That is what you need to remember. So what are the contents of axilla? Is a favorite MCQ. Remember axilla, axillary artery and vein, infraclavicular part of brachial plexus, lymph nodes, long thoracic and intercostal brachial nerves, and axillary fan. Remember axilla, the contents of axilla. Which muscle is not part of posterior wall of the axilla? Teres major, subscapularis, latissimus dorsi, they are all the posterior part of the axilla. Once more, posterior part is not by. What are all the structures present in, which is the important structure present in posterior axillary wall? Subscapular artery. So, subscapular vessels descend along the posterior wall at the lower margin of subscapularis. Similarly, the axillary vessels, axillary vein is anteromedial to the artery and the brachial plexus. They run from the apex to the base along the lateral wall. The long thoracic nerve descends on the serratus anterior and the intercostal brachial nerve perforates the upper anterior part of the medial wall. So all this anterior, posterior, medial, lateral walls and the contents of axilla, high yield topic that you have to master now. Come on, let me give this question as a quiz for all of you. Clavipectoral fascia is not pierced by. Punch your answers, doctor. Please punch your answers. Clavipectoral fascia is not pierced by. How do you like to respond to this question? Yes. Deepthi Birla is proposing lateral pectoral nerve. Ritu Raj, after a long time, please welcome. Nirbhay Kumar is also saying lateral pectoral nerve. Nay. So clavipectoral fascia It extends from clavicle above to axillary fascia below. It encloses subclavius muscle, and the lower part of it will split to enclose pectoralis minor. It also helps to pull the axillary fascia, and the upper thickened part of it forms costocoracoidal ligament. So now comes a very important question. What are the structures that pierce the clavipectoral fascia? Lateral pectoral nerve, cephalic vein, thoracoacromial vessels, and all the lymphatics from the breast and pectoral area is what you need to remember. अच्छा भैया, आप लोगों में सर्जन बनने का ख्वाब कौन देख रहा है? Axilla में level 1, level 2, level 3 lymph nodes बट्टी मारना पड़ेगा बड़े सर्जन बनने के लिए आप. So level 3 nodes are superomedial and above the pectoralis minor. So if you look at the anatomical classification of the axillary lymph node, remember the mnemonic apical. What are the various groups you have? A, anterior, P, posterior, I, infraclavicular, central, apical, lateral. These are the groups of lymph nodes. Excellent, Rituraj. I'm so proud of you. Sir, I have joined MD Anesthesia in Guwahati Medical College. So proud of you. So Rituraj was also preparing like all you guys last year, and I had a great opportunity to be his teacher. Just like our Manali Gaur, who is our regular student. Rituraj used to be like our very regular student. At a point of time, for the teacher, students become an addiction. Without you, there is no life. Just other day, my friend, who is an orthopedic surgeon, Dr. Ram Kishan, his son got in triple IT in Guwahati. He said, Dr. Murali, do you have anybody among your students who is in Guwahati? So now I will ask my friend's son, Dr. Ram Kishan's son, who is joining triple IT. He will have a big brother, Rituraj, to take care of him far away in Guwahati. The boy is traveling from Hyderabad to Guwahati. So definitely, Rituraj, I will try to pick up the phone number of you and try to please help the little kid who will be joining triple IT in Guwahati, traveling all the way from Hyderabad. Now, doctor, axillary lymph nodes. What is the classification? Level 1 nodes. All those nodes which are inferior to the inferolateral border of pectoralis minor, level 1 nodes. They have lateral, anterior and posterior nodes. Level 2 nodes. Nodes posterior to the pectoralis minor. It includes the central nodes and some of the apical nodes. Thank you, Ritu. Right away, I am making a note. 80590-92417. Okay. So Dr. Ram Kishan is a surgeon. He is the medical superintendent of Mehboob Nagar Hospital and a very dear friend of me and was my senior in medical college. I will pass on your number so that he can be able to, he will feel safe that his little kid going all the way to Guwahati from Hyderabad is safe, right? Good. So level 3 nodes The nodes which are beyond the superior border of the pectoralis minor, and they include apical and infraclavicular nodes. Axillary sheath is a continuation of prevertebral fascia. So the first part of the axillary artery is enclosed with the axillary vein and the brachial plexus inside the axillary sheath. So what is this axillary sheath? Basically, it is nothing but the continuation of the prevertebral layer of the deep cervical fascia. Once more, cervical fascia, what are the layers of it? Everything you need to catch up and do a revision. So that is the story of axilla. Now, doctor, let's go to the next favorite topic. So, totally there are 56 topics in anatomy. Tomorrow's anatomy exam, NEET PG, out of 20 questions examiner is going to ask, they come from these 56 topics only. So our crash course intention is to ignite you, to stimulate you, to bring a focus to you as to what are the important topics that you need to master, right? So now let's make the great beginning. Coronary circulation. Third coronary artery. Who is going to give me the correct answer? Correct answer. So coronary circulation comes in cardiology also tomorrow, in DM cardiology, NEET super specialty entrance also. So doctor, conus artery. So you should remember, you have the right coronary artery and arch of aorta. So there is a branch coming out of it which is called as conus artery. So the first branch of the right coronary artery, which is arising separately from the, in some people, from the anterior aortic sinus, it arises. It is the arteria conae arteriosi, otherwise called conus artery, is what you need to remember. This is sometimes called third coronary, but a similar kind of a conus artery also comes from left coronary. That's the reason better we call it as right conus, left conus. So you can see the right coronary artery will be giving rise to right anterior conus artery. And left anterior descending will be giving rise to left anterior conus artery. And both of them have a confluence. So that is what you need to remember about the conus artery. So the left coronaries, left anterior conus, and right coronaries, right anterior conus will combine together to form the annulus of Vucens, is what you have to remember. Now the venous drainage of the heart is another favorite topic of the examiner. What drains into coronary sinus? Everything drains into coronary sinus except anterior cardiac vein. So there is a middle cardiac vein, there is a small cardiac vein, there is a great cardiac vein. So great cardiac vein, middle cardiac vein, small cardiac vein, everything drain into coronary sinus. But the anterior cardiac vein empty directly into the right atrium is what you have to remember. So that is the favorite question every time asked by the examiner. Great cardiac vein, where does it lie? So typically, if you look at the anterior surface of the heart, interventricular groove is there, right? In that you have the left anterior descending artery passing. In that you have the great cardiac vein. The great cardiac vein will be passing is what you need to remember. So this is the posterior interventricular artery, the middle cardiac vein, the right coronary artery, the small cardiac vein. So you have to be very sure on the structures. So anterior cardiac veins, where do they drain, doctor? They drain into right atrium is what you have to remember. So left coronary artery, what does it supply? So this is one of the favorite questions. Left coronary, right coronary, what do they supply? Which part do they supply? Right coronary supplies entire right ventricle, except a small region of the anterior interventricular groove. Similarly, it supplies left ventricular diaphragmatic aspect. It supplies posterior inferior 1/3. Let us say interventricular septum is 2/3 anterior, 1/3 posterior. This 1/3 of the interventricular septum, right coronary. Similarly, it supplies the right atrium is what you need to remember. It also supplies part of the left atrium and the conducting system, right coronary artery. Then what is left coronary artery? Most of the left ventricle, a small strip of right ventricle, anterior 2/3 of interventricular septum, and the major part of the left atrium. All the cardiologists keep talking right dominance, left dominance, dominance बोलते क्या है dominance क्या होता है? Dominance is decided by the origin of the posterior interventricular artery. The right dominance, the posterior interventricular artery is derived from right coronary. Left dominance, posterior interventricular artery is derived from the left coronary. That is what you need to appreciate. That is all the story, doctor, about the coronary artery circulation. The next favorite topic, number 12, is cerebrospinal fluid. Let's talk about it. So, first time when we are in the hospital as interns, meningitis case, postgraduate will give you an opportunity to scrub, get the gloves, clean the skin with betadine, take the needle, do a lumbar puncture. Wow, what a great feeling when you're doing lumbar puncture. You'll be thankful to the postgraduate saying that, Anna, thanks for teaching me. So CSF, favorite topic of exam. Maximum amount of CSF, where do you find? It is in subarachnoid space. Now, there are a few numerical values you have to master. Total CSF volume hota hai. Alladi Vinay absolutely agrees with me. 150 ml. Out of which 125 ml is intracranial. Ventricles have 25 ml. Almost all of this 25 ml is in the lateral ventricles. Remaining 100 ml is located in the subarachnoid space. What is the rate of formation of CSF, doc? 0.35 to 0.4 ml per minute. 50% of the total volume of the CSF is replaced every 5 to 6 hours. Foramen Megendi, or the median aperture, from where does it drain the CSF? Fourth ventricle. So you must be very sure. Where is foramen of Luschke and Magendie? Foramen of Monroe. So, anterior horn, posterior horn of the lateral ventricles. If you look at the lateral ventricles, they have anterior and posterior horn. The junction is called the trigone of lateral ventricle. It is called trigone of the lateral ventricle, is what you need to remember. So the lateral ventricles connect to the central third ventricle through the interventricular foramen of Monroe. So both the lateral ventricles into single third ventricle, you have the Monroe's foramen. The floor of the fourth ventricle, how is it formed? With the posterior surface of the pons, sulcus limitans, posterior surface of medulla, they are all the part of it. So you can see this, the median sulcus divides the floor into symmetrical halves. The floor of the fourth ventricle is also called rhomboid fossa. So this is a cranial half of the medulla oblongata, which is the part of the floor of the rhomboid fossa. Here you have the facial colliculus, typically. So the floor of the fourth ventricle, favorably asked. Now punch me the answer, doctor. The rate of formation of CSF typically is around 500 ml per day, half liter. In newborns, it is as little as 25 ml, whereas healthy adult, it will be 500 ml per day. That is the quick story of cerebrospinal fluid. Now the topic number 13. Sure shot आने वाला टॉपिक्स है ऐसा. Stratified cuboidal epithelium. Once more, I want to tell you all, guys. I will quickly show you. We have the Incus quiz, which is a hourly multiplayer live quiz tournaments are all available here. Please download. Here you get 20,000 question bank, the revision, a graphical analysis, a leaderboard, many things which are all there. Please write a good review on the Incus quiz app. And what all that we are discussing now or here, they're all available both on the mobile app and also on the web. So once you go to the Incus web, just like mobile app, you need to log in. So just like the Android app, you can even play the quiz tournaments on the Incus web app also. Whether you play here or there, it is same. So now we are discussing anatomy, rectum. 4 players have booked. कितने बजे को है? 10:30 को। फिर 11 बजे को एनाटॉमी Axilla is being created as a quiz. Just now we discussed coronary circulation. It is being created like a quiz. Suppose if you miss this quiz tournaments, you can go to the completed tournaments. So there are already around 424 tournaments. So you can see anatomy, foramina, foot, root value, inguinal canal. अभी हम जो भी डिस्कस किए थे वो सब यहाँ अवेलेबल है. Even if you are little late, doesn't matter. So once you say autoplay, typically it will take you back, and once you answer the question, you will be able to know how many answered A, B, C, D, etc., etc., etc. So that is what I am trying to tell you. If you correctly answer within the first 5 seconds, you get, if it is the right answer, 1000 marks, bonus points, leaderboard, everything. So you will get that quiz kind of a interesting feeling when you are playing on the Incus quiz app. A very interesting feature is called history. So once you go to the history, all the games that you have played till now, after you play, they all come into the history. So once you go to the history, once you click on any of the tournament, for example, obstetrics gynecology, I have played earlier. I can see all the questions that have been asked. You also have analysis. What is the correct answer? What was your answer? Whether it is right or wrong. You can bookmark it for the last moment revision. And once you click, you can see the question, you can see the explanation. And here, you can add an audio comment, video comment, etc., etc. So that is a beauty thing. You can. Rana Rawouf is saying, sir, app is not working properly. Please feel free to give a quick call to 9000-868-356 anytime when you have any issue. The whole problem with the Android phones is so many varieties of Android phones. So that is the reason sometimes certain type of Android phones, there may be problem. But any given day, the web app, you can even play on the web app also. It doesn't matter, right? So you can be able to do the review. You can be able to add the comments. And you have the explanatory answer for the question, for you to do the revision, everything. So I urge all of you to play. And a very interesting feature we have introduced is called rights and wrongs. So if you click on this rights and wrongs, you can be able to see all questions that you answered right. You played 10 different tournaments. All the questions that you answered right will come to one place. You can also see what is the correct answer, how many people answered this. Totally 21 people answered this question. Only 10 answered correctly. Only 47% correctly answered, and you kept it right. So once more, when you click on that, you can be able to see the question. So that way, it helps you. Similarly, you can also see what are all the questions that you answered wrong. So once you go to all your wrongly answered questions will appear at one place. Once more, you can see how many others have answered it correctly. And if 100% answered it correctly, I'm the only guy who answered wrong. Oh my God, I'm more worried. So we give a lot of analytics, topic-wise, subject-wise, how you are doing good, where you need to improve, everything. आप खेलते जाओ, हम बताते जाएंगे, आप और क्या पढ़ना है, कहाँ improve होना है. That is the Incus Quiz Tournament app. So I want all of you to download the Incus Quiz Tournament app and enjoy a playful way of preparation for the entrance exam. Now, stratified cuboidal epithelium. So epithelium types is next favorite topic. So stratified cuboidal epithelium. So Allah Viday, I'm just requesting you, what exact problem that you had in the app, if you can kindly tell, we are more than happy and eager to help you, actually. Even in the App Store, Apple, iOS also, tomorrow morning, the app is going to come. Now, stratified cuboidal epithelium, where do you see? Typically in the sweat gland ducts. So, where do you find different types of epithelium? Is a favorite question of the examiner. You have to be 100% sure about it. Simple columnar epithelium, you can remember. Where is it present? Stomach, intestine, both large and small. Respiratory tract, uterine tubes, auditory tubes, efferent of testis, brain, gallbladder. You can find simple columnar epithelium. So you can see the sweat glands, the ducts. So the ducts of the sweat gland have a stratified cuboidal epithelium, cuboidal shaped cells. So the ducts of sweat glands, mammary glands, salivary glands. Typically, you find stratified cuboidal epithelium. Once more, the epithelium of the ovarian follicles is stratified cuboidal, while that of the ovaries, directly ovaries, is simple cuboidal, which is not a connective tissue. Basically, blood, bone, cartilage, they are all called connective tissues. Trachea, pseudo-stratified columnar epithelium. So, pseudo-stratified ciliated columnar epithelium. That is what you need to remember. Lingual surface of epiglottis. The epithelium which is lining the lingual surface of epiglottis. Typically, you have stratified squamous epithelium. So, the entire lingual surface of the apical portion of the laryngeal surface is covered with the stratified squamous epithelium. Whereas towards the base of the epiglottis, where you are having the laryngeal surface, it is the ciliated pseudo-stratified columnar epithelium. Vaginal epithelial lining, what is it made up of? Stratified, squamous, non-keratinized. Obviously, it should not be keratinized. Non-keratinized, stratified squamous epithelium is what you have to remember. So the type of epithelium is the next Favorite topic of the examiner doctor. Now, let's take up the last topic for the today's evening. Foramen of Winslow. So what are the boundaries of the foramen of Winslow? Keep punching the answers, doctor. You can even go back to the mobile app and then you can be able to play these quiz tournaments. Boundaries of foramen of Winslow. Inferior vena cava, free border of lesser omentum and second part of the duodenum. So typically foramen of Winslow is the place where you have the portal triad, hepatic artery, bile duct and portal vein. So this is the lesser omentum, this is the stomach. So Vinay is saying the review of the played tournament does not show if I missed playing it. Okay, good point. Or if I pressed back button by mistake. Oh, Vinay, basically the concept is like this. Whenever you register for a game, it will show you a time counter that the game is going to start. At least 10 seconds before the game, you need to be there inside the tournament. At least 10 seconds before. So that when the clock goes to 0, then the music begins and the questions will start streaming. By chance, you registered for a game, and if you happen to not, if you forget it, then after the game is over, even if you registered and did not play also, it should go into your history. And there you can be able to see how others have played. So that's the point. And yes, I'm forbidden to enter the tournament again in the middle. Okay, that's the only issue, right? Okay. Yeah, marketing people are not technical people always. Their intention is basically to help you, no doubt on that. They're very dedicated people who counsel and help you. But otherwise also, please, anytime feel free to give suggestions. It is an app created for all of you. Incus is, आप सबका ऐप है, जैसे ड्रीम 11 पूरा क्रिकेट देखने वालों का ऐप बोलते हैं, वैसा ही आपका ऐप है, आपके लिए आपका प्रिपरेशन को इनोवेट करने के लिए, एक्साइट करने के लिए हमने बनाए, राइट? सो थैंक्स वेरी मच फॉर द फीडबैक, विनय. I will definitely consider whether we can let the people enter into the app. So Viday, if you are not at the part of our quiz group, 9000868356, please become part of the quiz group so that proactive people like you giving good feedback will make us to create an app in a better way anytime. Now, this is basically the finger. Very good. Good, Vinay. So let's discuss some more suggestions. How you want it in a better way. We will do that. But only please tell me that the app is not crashing, right? The app should not crash. That's the only thing. We are going to introduce this rights and wrongs tab tonight. And with the rights and wrongs tab, it will become easy that all questions that you answered wrong will come to a place and you can be able to do a revision, bookmark them, etc., etc. And another good feature we are introducing tonight in the Incus app is you can use your camera, video, everything like TikTok. You can upload the videos, audio, comments, everything under every question while you are reviewing the questions, right? Now, so what are the boundaries of the epiploic foramen? Anteriorly, there is a free border of the lesser omentum known as hepatoduodenal artery ligament. And this has got two layers. And in this hepatoduodenal ligament, you have the common bile duct, hepatic artery, portal vein, all the three. So this hepatoduodenal ligament, which is between the liver and the duodenum, it has two layers, one anterior layer, one posterior layer. So you should remember the peritoneum covering the inferior vena cava, because below this foramen of winslow, you are having the IVC, which is passing. The peritoneum covering the IVC is posterior to that. The peritoneum covering the caudate lobe of the liver is anterior to that. The two constitute hepatoduodenal. Inside that, you are having the portal triangle. So that hepatoduodenal ligament is the anterior border. Then you have the inferior border, the peritoneum covering the commencement of the duodenum and hepatic artery. Then left laterally you have gastrosplenic ligament and splenorenal ligament. Now, superior border of the epiploic foramen, it is formed by the caudate lobe of the liver. Posterior relation of the epiploic foramen, inferior vena cava. So now you are all champions in the topic of the foramen of winslow. Last एक topic discuss करके जाएंगे या tomorrow afternoon once more at 2 o'clock. मेरे प्यारे भारतवासियों, हम सब मिलेंगे और मिलके पढ़ाई करेंगे रोज. So tomorrow at 2 o'clock, afternoon 2 o'clock, I'll try to schedule the YouTube session. So please make an opportunity to click on the bell sign, set a reminder so that you will get a notification before starting. Study well. You have great time ahead of you. COVID has given you another 60 days of bonus. So that will make it almost 120 days. Any entrance exam, you should not read more than 120 days. That's a simple rule. So even if you start today, you can become a topper in no time. Good luck and enjoy a great preparation. Thank you.